Hello, everyone, and welcome to the SOAP note assignment review. So this will be a little lecture over our SOAP note that we did for our client, John. So just briefly, what is a SOAP note? So a SOAP note is a goal-focused or treatment-focused therapeutic written record of what you have done with your client during the manual therapy session. So S is subjective, all right? It's subjective information from the client. So this is anything that they tell you. This is what they are feeling. This is what they are experiencing that you don't necessarily see. As a massage therapist, you might touch them and feel inflammation. You might be able to record a fever, but they're going to tell you that they feel hot. That's the subjective portion. They feel hot. They feel pain in a certain area of their body. They feel dizziness when doing a particular motion. They feel like they have a decreased range of motion, which can also be objective because you can test that, but they feel that they are unable to do something. So this would be found right here in this subjective section. They're going to tell you what their goals are. They're going to tell you the symptoms that they're feeling. I feel hot. I feel pain in my lower right hand back. My goal is to not feel that pain in my lower right hand back. My goal is to feel normal throughout the day and not overheated. What do their symptoms improve with? And what did they tell you that they worsen with? My back pain improves after sleeping all night. My back pain is worse after a long day at work. You know, whatever it is that they tell you, this is an excellent place to record it. The O in SOAP stands for objective. This is data that is based on inspection, palpation, testing, and your written record of the interventions that you performed. Okay. So you are going to be describing what you see, what you feel, and what you did to them. Just an objective observation. And you would put it over here in this section. This is what you saw visually about your client. When they came in, you may have done a postural assessment and you took a peek at them and you're like, man, their right shoulder is really elevated, but they didn't tell you about that. They just said that the right side of their neck was tight. But looking at them, you can see additionally that their shoulder is elevated. This is a visual observation. Palpation, you palpated their right shoulder and their upper trapezius had a ton of tension in it. You notice that in addition to the shoulder appearing elevated, you could feel a difference in the length of the neck before connecting with the shoulder between the right and the left-hand side of the body. The modalities that you applied, did you do myofascial stretching techniques? Did you do neuromuscular facilitation? Did you just do some Swedish massage with effleurage strokes to sort of relax them without overworking the tissues? What modalities did you apply? The A in SOAP stands for analysis and assessment. And this is for both the subjective and objective data. Subjective, meaning how they feel. Objective, just an impartial observation from you, the practitioner. So this is an analysis of how effective your work was. Did your manual therapy work or not? Did all of the methods that you used work? Did only some of them work? What were the changes that came about? Did you perform an ice massage, right, on someone that has limited range of motion? If they have a lot of pain in the affected joint, usually like at the proximal attachment site, all right, for those muscles, if you perform ice massage, not only does the ice perform a palliative care for them pain relieving care because it does numb the area. It causes vasoconstriction, so it gets some of that inflammation out of that area. But it's also been shown to increase the range of motion, especially when active resistive stretching is applied. So you could put that type of information right here in assessment. You would also put goals, their goals and your goals. All right. Their goal is to have their lower back pain stop hurting. Your goal is to have them have more flexibility and less pain in the same area. Their goal was to have their right side of their neck stop hurting. Your goal is to achieve homeostasis with balance again and posture. So you want postural equilibrium. You want both shoulders at the same height. And you also share the goal of wanting the client's pain level to decrease. So you would put these things in the goal section. And P is for plan, including the methodology used in future interventions. So what are the things that you want to do to them next time? Was the ice massage effective? Do you want to do that again? Do you want to try a heat cold therapy where you contrast? You apply heat, then you apply cold, and then you apply heat again. Do you want to give them any recommendations for stretching or changing things that they do throughout the day? These are all things that you would put here in the treatment plan. Those are what you plan to do in the future. I plan to see them once a month or once a week or twice a month. I plan to continue to use stretching on this particular joint for a portion of the plan. I plan to work on depressing the right shoulder. I plan on decreasing the tension in the right trapezius or in the right lower back in the QL, the quadratus lumborum muscles. All right, this is where you put your plan and where you put a self-care plan. Now, you need to stay within your scope of practice for the self-care plan. Obviously, you can't prescribe medication. You can't say, hey, you should be taking ibuprofen every day because you're so inflamed. No, you also cannot prescribe stretching and exercise. You can stretch them on the table. You can show them a stretch that you find effective in the office. You can tell them, I find it very therapeutic to do this, and show them the stretch. You can say, I have had many clients find that this stretch, and show them, is very effective on similar symptoms. You cannot say, you should go home and do this exercise or this stretch 3 or 4 times a day. You're not a physical therapist. You're not a doctor. You have no prescribing power. You cannot tell them what to do for stretching and exercise regimens at home. You can show them those. You can perform them on the table, and you can tell them what you find helpful or what other clients in the past have found helpful if they think it is something that would also benefit them. Please be careful of your wording to your clientele, okay? This will save you from future legal trouble. It'll save you from potentially accidentally hurting a client. It's just better overall. All right, now there are 2 other sections that are not within just the SOAP portion of this that I have included on here. Here we have a preferences section. And we also have this legend down here with some models. All right, in this preferences section, there's this strange term, massage media. It is a combination of everything that you use during the massage. It is not just massage medium, which is whether you use lotions or oils. It is also, did you use thin sheets, thick sheets? Did you use a table warmer? Did you use a heated electric blanket? Did you use hot stones? Did you use cold therapy? Did you use a particular scent? Did you use some type of special pressure tool. What are the things that you used during this massage for this client? Table setup. All right. Is this person super tall? Do they need a tall table? Do they have difficult getting onto a high table? Did you need to lower it for them? Did you have to put on an extra blanket because they're very susceptible to cold? Did you only have one thin sheet because the person feels overheated all the time? Are they allergic to a particular type of linen, so you had to put a different type of sheets on the table for them? Do they have really bad flaking skin or other things where you would want to put a protective layer between that top sheet that they lay on for comfort and whatever else that you have underneath it, so that you don't have extra things falling through the fibers of your sheet setup? These are all things to put there and consider. Hot and cold therapies. You can include it in media as a tool, but here's a separate section for just that. Did you use hot stones? Did you use a hydrotherapy pack? Did you use a hydroculator? Did you use an ice pack? Did you use a frozen cup of water as a little ice cube tool to work on them? You would put all of that information here. Music. What are the client's preferences? You know, I had clients come in requesting Bob Marley, some alternative rock, classical. Some people wanted silence. About 2% wanted spa music. You know, it was a wild mix. I asked my clients what they prefer listening to, and I would find it for them, usually on YouTube. You know, Spotify is pretty good. It doesn't have any advertisements. My favorite thing to do was make massage mixes for particular types of clients. So I could just pop in a CD and go, and then I would know by when a particular song hit if the hour was almost up. But that can get kind of tricky, because if you have repeat clients who listen to the repeat CDs, they sort of know the timing of the massage as well. And it can become a little monotonous and boring if they're actually paying attention to the music during the massage for them. So keep that in mind. Client preference is a big thing. I would actually ask them about music. When you first start in your massage therapy career, you might feel a little bit nervous, so much so about the massage itself that you forget that the atmosphere, the ambiance of the setting very often sets 50% of the mood before you even put your hands on them. This is an excellent section to include in your SOAP notes, not only for client physical needs and preferences, but as a marketing tool. You know, it's not just that they can't get on a high table. Maybe they prefer a low table anyway because they, you know, have a fear of heights and they honestly like to lay as close as they can to the ground. These are excellent ways to remember things, to make the next time they come into your office that much more special. And it absolutely will set you up for making more money because you'll have more repeat clientele. Now, the last thing here is this other section. You absolutely want to put important information here. Maybe the client was weird. Maybe the client asked for a happy ending. Maybe you noticed something really concerning, like hand-shaped bruises all over the client. True story. Maybe you found out about an allergy and put it here. I had a client who used to see me often, and I remember this to this day. This was close to 15 years ago, and they told me once they were allergic to Sombra. It's a brand of pain relieving gels and stuff that you can apply to the body. And the next time they came in, because the office that I worked for did not keep SOAP notes, and I was not used to writing my own SOAP notes. And because I was working in a medical office, they didn't want you to write your own SOAP notes and then keep them, because then you were taking information about patients out of the office, which I found to be very ineffective because, you know, when you see 8 patients a day, 5 days a week, by the time she came back in 3 weeks later, I had already seen a whole lot of other bodies in between then. And I forgot that this one particular patient, now I did remember her and I remembered her back pain and stuff, but I did not remember her allergy to Sombra. It wasn't in her medical chart. This is an excellent place to put it. All right. It's absolutely an excellent place to put it. And honestly, I cannot express this to you enough. If you have your own private practice, soap notes can keep you out of legal trouble. If something happens, a client says you did something weird or something happened, you can pull up your soap notes. If your client comes to you after seeing you 4 or 5 times and says, hey, can I have like a copy or like an extra receipt of everything we've done? I'm trying to get reimbursed from my health insurance, but they need this information from you. You can pull this up and this client can get paid the reimbursement from their healthcare insurance, especially if you're not operating underneath someone's license or your own, where you are able to bill PIP, which is personal injury protection, automotive insurance, or you're unable to bill for healthcare insurance for manual therapy. You can give copies of your notes to the clients so that they're able to get reimbursement. Keep soap notes if you can. I'm telling you, remembering small things like your client's favorite music, their client's favorite scent, their favorite lotion, all of these things, their favorite modality, will make you seem like a phenomenal psychic magician. And they are going to keep coming back to you because you know them and their body so well. Even if you completely forget who they are, the better your soap notes are, the better you are going to get to know your client and the better you can make your business. Now, this bottom section here is the last little portion I'm going to talk about before we move on to John and what we need to write about John. And not every soap note has these, and I wish that they did. So this legend over here, for those of you who don't know what a legend is, it's a key to what the symbols that you write mean. So if I put a star on something, okay, like will it allow me, oh, let's see if I can draw a star here. All right, I put a star here. Doesn't really look like one, but it kind of is. All right, I put a star here. That stands for inflammation. All right, the client came in with inflammation in their right trapezius. They're describing that it's hot, that it's tender. I'm also going to observe that it was elevated. So I'm going to put an upwards arrow right above the shoulder. It was elevated. You can see this elevation right down here. All right, and the star for inflammation. If they have a tender point, okay, they were talking about their low back, boom, we can put a tender point on there, okay? If they have a trigger point, say I press right here underneath the scapula, and they feel it shoot all the way up into the jaw here. So I put an X on the trigger point underneath the scapula because they felt it shoot all the way up into their jaw. That is a trigger point. I know some of these terms might be new to you in the 105 class. Don't worry, they will come to you. You will be covering these in clinic. You'll be covering these hopefully in a couple of other of your classes. Certainly you will see soap notes again in pathology, and you will also see them in advanced anatomy. So you'll get a couple of chances to practice at these soap notes. All right, John's intake. Your client comes in. He is complaining of a sore lower back, mostly on his left side. He cannot lift his leg very high. He has difficulty getting into high beds and chairs, and it hurts when he turns. He states he prefers piano music, but no water sounds because it makes him need to use the restroom. He is allergic to lavender, and he doesn't like the greasy feeling of oils. He just wants the pain to stop in his lower back. You see that John leans to the left when standing. His left foot is turned inwards, and his neck is craned to the right to keep his head somewhat in the midline of his body. When laying prone, You feel heat and tension in the lower left quadrant of his back, lateral to the spine. It is inferior to the ribs and superior to the hip. He reports it as extremely tender to the touch. Do you put heat or cold therapy on his inflammation? What else do you feel or observe during this session? This is what I want you to fill out on the SOAP notes. What did you palpate? What modalities did you use? Did you avoid the area because it was so tender and work around it? Did you work on other areas that can be affected, like his neck? Explain what you did. Be creative when answering all of the SOAP note questions below. He doesn't want to do stretches at home. Are there movements he could avoid and things he could try to do to lessen the pain? All right, so I've already filled in here John Doe. We're just going to put his name in. And we're going to party like it's 1999. So up here for client name and for the date, we are going to put John Doe, and we are going to put whatever the date it is that you are filling it out for your client. If you're doing this for a school assignment, do it on the day that you're doing the assignment. If you are doing it for an actual client in clinic, or a client in your actual practice after you have graduated and become licensed, put that date. Always put the date so that you can refer back to it. And I honestly would also put the time. So on my notes, I would put, the month, the day, the year, because we are living in the States. Usually everybody else, just so you know, writes the day, which is the smaller unit, and then the month, and then the year. We're kind of weird here in the US. So we put the date, and then we put the time. You can either do it in military time, which a lot of medical offices do, or you can do it by the 12-hour clock. This person came in at 3 p.m. So I'm going to put 3 p.m. You can also put 1500 hours, whatever works best for you. But whatever you choose to do, stay consistent. I would also put in here the time length, or how many units I did. If you're being billed by insurance, they do it in units. Units are 15 minutes. So if you did 1 hour of massage, I would put 1 hour MX. And then if you were doing for insurance, I would put 4 units MX, or manual therapy or massage. So this is what is going in this section here. All right. Now, the preferences section. Okay, this is the section that we are filling out now, right at the top. You don't have to fill this out before the massage starts. You can put a few notes in there so that you don't forget it. Okay. Definitely, so that you don't forget it for next time. They're really important things, because a lot can happen during a massage. And then as soon as that client's up and you're trying to get the entire room cleaned and changed over for the next one, you could forget to fill this out. And if you're stuck filling out the rest of your SOAP notes at the end of a busy workday, you could forget important stuff. So if it's something that he tells you when they come in, go ahead and put it in there now. If it's something that happens during the massage, you can put that in later. Now, luckily, this is an assignment, so you have all the information you need right at the beginning. All right. He's complaining of a sore back. That doesn't go there. What about this? He cannot lift his leg very high, has difficulty getting into high beds and chairs, and it hurts when he turns. We don't really need it hurts when he turns. He states he prefers piano music, but no water sounds because it makes him need to use the restroom. He is allergic to lavender and doesn't like the greasy feeling of oils. This is the important information for this section here. So massage media, I'm going to put that we use the medium of water-based lotion, no oils. And I'm going to put used ice block in cup for ice therapy. So I know exactly what I used. Okay. You can put a tongue depressor in a Dixie cup and fill it with water so that you have something to hang on to the ice with. And it's nice and wide. It won't break like a popsicle stick will, so that you can apply ice to the patient's skin without having to hold the ice yourself the entire time. This is a cool little trick if you don't want to use ice packs, because very often in tight areas, I use the massage similar to a stone for cold therapy instead of hot therapy. You can also put your hot stones when they're at room temperature. Don't ever put a hot one in the freezer. They could potentially crack depending on what they're made out of. But if you use hot stones, you can actually put them in the freezer and use them as cold stones for your therapy as well. So keep that in mind. All right. Table setup. It says that he cannot lift his leg very high. So table set low because he has difficulty lifting legs. Okay. We don't want him to get hurt because he can't get on the table. All right. Or alternatively, you could say, or used a step stool. If you couldn't lower your table low enough, he used a step stool to make his way up into the bed. All right. Hot or cold therapies. He had inflammation in his back and it was extremely tender. I'm not going to put heat on inflammation. All I'm going to do is inflame the inflamed. That doesn't help ever. So I used a cold therapy. Oh, it would help if I could spell, wouldn't it? Cold therapy. And in fact, I used my special ice block, and you can call things certain things in your office. A lot of times we called hydroculator packs, just the hot pad, and we would all know what it was. So I'm going to call my ice cup therapy just my ice block. Music. He says he prefers piano music, but no water sounds because it makes him need to use the restroom. So I'm going to say no water sounds in capitals, so I know for next time. Just like I put no oils in capitals. Sometimes you can even circle that. All right. Prefers piano. Used spa mix number 1. Liked it. So I know, hey, I have my certain mixes. I know that he likes this one, so I can choose similar music if I want to. Other, is there anything other that I want him to be doing? Yes, or stated about him, I should say. Is there anything else that I need to put about my client in here? Hello, he is allergic to lavender. Let's not cause anaphylactic shock. If you have this, circle it in red, or if you keep notes on hard copy, like in files, put that right on the outside of his folder. If you keep it in an electronic system, like most chiropractors and stuff do, see if they have an allergy flag that will pop up the minute you open his file, no matter what you're doing. Okay. So we need to know that he's allergic to lavender. A lot of generic lotions and stuff have lavender in them. We need to know that this man cannot have it anywhere around him. Don't put that in your scented oils or anything for aromatherapy for the day if this client is coming in, right? Next section is subjective. All right. What are your client's goals? What are their symptoms? What do they improve with? What do they worsen with? Okay. So he comes in complaining of a sore lower back, mostly on his left side. He cannot lift his leg very high, has difficulty getting into high beds and chairs, and it hurts when he turns. All right, blah, blah, blah. We don't care about any of that for what he's feeling, but we do have this goal of he just wants the pain to stop in his lower back. Okay, this is objective. We see that he's leaning when he's standing, so we're not going to put that here. We're only looking for subjective when he says, all right, He reports, when laying prone, we feel the heat and tension in the lower left quadrant of his back. We're not going to put what we put, but we're going to state that he reports it is extremely tender to the touch. Okay. He does not want to do stretches at home. This is subjective. This is something he doesn't want to do. All right. All of these highlighted things are things that have to do with the client's goals and the client's symptoms. Now, this says be creative when answering all of the SOAP note questions. So you're given some of it, but I want you to have fun with the rest of it. Okay. Client wants pain to stop in his lower back. All right, that's what we're looking for. Client wants his pain to stop in his lower back. His symptoms are extreme tenderness, and this is going to be in the lower left quadrant of his back. So I'm going to put low L, quad for quadrant, and back. Okay, or I could put of back. And what you'll see a lot of people do is they'll do L with a circle around it, and that means left, or an R with a circle around it. And that means right, of course. Cannot lift leg very high. So we're going to put a downward arrow for decreased. And we're going to put ROM for range of motion. Okay. So I'm going to put decreased range of motion because he cannot lift his leg very high. But I'm going to specify that he can't lift his leg, not just put decreased range of motion and not know what body part I'm talking about. I'm going to follow up with leg or legs because it's probably both if he's complaining about it, right? Who knows? This doesn't say. So you could say only in his left leg or both legs. So sore lower back, mostly on his left side. So we do have that low left quadrant of back. Okay. It improves with. He doesn't tell us what it improves with. So we're going to make it up, right? Because this is an assignment. This isn't real life. If it's real life, you're not going to make up things about your client. You're going to ask them what it improves with. But I want you to be creative here. So we're going to say improves with stretching the left side of his torso. And also, we should say cool showers, perhaps, because we know that he is very inflamed and a hot shower might inflame it more. And he tells you that he takes ibuprofen, taking medicine for inflammation. Okay. It worsens with, what does it worsen with? Well, it would worsen with leaning to the left. He probably doesn't realize that he's continuing to shorten everything by leaning to the left. But he's leaning to the left, which makes it worse. And possibly also, working, all that constant movement working. After working all day, he's hurting a little bit more. Okay. So we're going to circle that, and we're good to go. Down to the next section. Okay. Objective. We are looking for visual things that we see, what we palpated, and what modalities we applied. And we're filling this in here. We're filling this in after the massage. You're filling in subjective before the massage. Okay. All right, let's see what we saw and what we felt. Okay. Let's see. He cannot lift his leg and it hurts when he turns. Blah, blah, blah. We don't need to know about the bathroom and the music. You see that John leans to the left when standing. His left foot is turned inwards and his neck is craned to the right to keep his head somewhat in the midline of his body. When lying prone, you feel heat and tension in the lower left quadrant of his back, lateral to the spine. It is inferior to the ribs and superior to the hip. He reports as blah, blah, blah. We don't care what he reports. And then these are all questions about what you do. All right. This is the important information for objective. All right. Visual. What does it see in the assignment? Leans to left when standing. Left foot turned inwards. Is it having an issue of inversion? No, his sole isn't facing inwards. His foot isn't turned up and out. It's the toes turned inwards. So instead of saying foot here, we should say left toes pointing. And what's the word that we use for inwards? We're going to say left toes pointing medial. Okay, then we're going to say neck leaning. It is leaning to the right because he's trying to keep his head above his spine to sort of maintain some postural balance there, because his body is leaning so far to the left, his neck and his head have to go to the right. All right, so we're going to put head / neck leaning to the right. Palpation when laying prone. So your client is face down. Remember, prone means face down. You feel heat and tension in the lower left quadrant of his back. So heat, and you can put T for tension if you want. I find that T stands for a lot of things. So usually I just write out tension. If you're taught a shortcut and want to keep it, by all means do so. There's heat and tension in the low left quad of back over. Pick the big muscle that you think is affected. I'm going to talk about the quadratus lumborum here, so I'm going to put QL. All right, there's heat and tension in the low left quad of back over QL. So that isn't confusing with like saying bilateral or anything like that. I'll go ahead and fill out back. Modalities applied. This is where you can be creative. I know that you're just starting school. I know that you haven't learned a lot of modalities yet. This is still fairly new to you. This is where I openly encourage you to do a little bit of outside research or read ahead a little bit in some of your, like your textbook for 101, okay, to see what modalities can be applied. You could do compression. Absolutely. I would do compression on the glutes. A lot of times you are your own pain in the butt. The pain of your upper butt is actually felt in the low back. These muscles work together. I would do compression on the glutes. I would do effleurage on back, perhaps some myofascial work on neck and right back. I don't want to do it on his left back because there is so much pain and tenderness there. I don't want to overwork the tissue. I will do ice massage on low left back. All right. And it would help if I would not type weird when I'm also trying to talk at the same time. Thank goodness I'm not also chewing gum. All right, here we go. I'm going to circle all these. I'm not going to circle QL. These are just abbreviations, but I want to specify left and right for sure. So I usually circle those. Okay. So that is what your objective information can look like. If these abbreviations are confusing right now, and I completely understand that they might be, by all means, you can write it out completely. When you fill in the assignment, it's a text entry, so you can put a whole paragraph if you want to. But in real life, it's easier to keep it just to the lines. Unless there's something really weird going on with this client, you want to keep it to a single page if at all possible, okay? I have had a couple of students fill this out on paper. As long as I can read your handwriting, this is an excellent exercise to actually print out and fill it out like you'd actually be filling it out for a job, and then just scan it and turn it into me that way. Or, take a photo with your phone if you're capable of doing that and submit it that way. That's completely fine for me. And that gives you practice to do it on here. If you're doing it in the text entry box in your assignment, go hog wild. But you need to be respectful and professional. I've had some funny answers in the past. I've had some really rude answers in the past. We don't want to get creative in the terms of the scenario. We want to keep it professional. And you are filling this out like you are actually turning it in for work or keeping it for yourself in your private office, with the idea that one day someone might ask you to show it in court, and you don't want anything rude about that client, which could be a potential lawsuit to pop up on that information. All right. I personally had a client who was covered in hand-shaped bruises. My soap notes were called in, as well as myself, for personal testimony in a domestic violence abuse court case. And they used my notes that I took during the massage as evidence, because they needed the date that was up here. They needed to know it was the client, and they needed to know what I had observed visually on them without prompting from that client. Okay, these are important things for you to have for your own legal protection. All right, our next section here is assessment. We are going to be doing an assessment of all of the changes that were achieved, and we're going to kind of talk about our goals for the client. Okay, like what we want to see, what we wanted to get done, not only in this session, but perhaps future sessions. What the heck is going on here? All right, this is the analysis and assessment of the subjective and the objective data. So you're going to ask them if they feel decreased tenderness. Did you see increased range of motion? All right, what went on? What did you avoid? What happened? All right, changes achieved. I'm going to say tenderness and tension. And this is why I don't put T for tension, because I like T for tenderness. And most people put T for tension and it gets confusing. So tenderness and tension decreased. I highly suggest putting a downward arrow for this instead. Decreased after ice massage. Okay. Range of motion increased, and you can use an upward arrow for increased. Range of motion increased after passive stretching of left leg and glute compressions. And is there anything else we want to say? Well, we could say inflammation decreased as well, because we used ice in the area of the low left quad of back. We did not do any friction. We didn't do anything that would increase a lot of inflammation there. We just did a lot of ice massage to decrease that tenderness and inflammation. Goals. We pain reduction to continue. Bring posture back to balance is a great thing. All right. Help leg rotate laterally. We want to work on that. So we're going to be working on loosening those muscles that are rotating his leg so that his foot is pointing towards the midline there. It's turning medially. We don't want it to do that anymore. We want it to go back to normal. Okay, so we want to help leg rotate laterally, and we want to increase range of motion and ability specifically to lift leg without pain. All right. Our very last section here is plan. Well, second to last section, I should say. The last section in the SOAP part of your SOAP notes is plan, and that is right down here. So this is where you're going to put your treatment plan and your self-care plan for him. All right, now treatment plan, we want how about bi-weekly massages for him, continued ROM and stretching in the massage, and we want to continue ice therapy on low left back because the inflammation seems to be a chronic issue at this point right now. We want to slowly start working on that area. Self-care plan. Remember, John hates stretches. Remember, he told you earlier, he did not want to do them. Okay. He doesn't want to do it. So you're not going to tell him to stretch. But what are things that he could do? All right, to avoid things at home or to sort of lessen his pain. You could suggest step stool for bed, gentle. You know what? We're not going to suggest anything that would be gentle movements because we don't want to even sound like we're telling him to stretch. How about encourage movements on the right side of body? So, you know, he is constantly picking up his groceries or walking the dog, holding the dog with his left arm. So the dog is constantly pulling him, you found out during the massage, and he's talking, and it's tugging him to the left all of the time, increasing his pain. Tell him to start walking the dog with his right hand. You know, make that a suggestion like, hey, have you thought about switching sides so that instead of leaning to the left when you're walking the dog, you're holding the leash in your right hand and you're leaning a little bit to the right, and having that downward pressure and squeezing on your right naturally tells your left side to stretch because it's the antagonist muscle. I know you guys aren't that far yet, but yes, when you squeeze one side of a movement muscle, the other side naturally relaxes. Your agonist, your prime mover muscle tightens up. The antagonist or the opposite muscle will automatically relax. So if he's tightening up his right obliques, all right, his right abdominals on the right hand lateral side of his body, the ones on the left hand lateral side of his body are also going to relax naturally because the nervous system is like, oh, one side is tightening. We got to let go of the other one. They can't both tighten at the same time. So encourage movements to tighten on the right side of the body to try to get that back to normal. You know, perhaps telling him to lay so that his spine is neutral for his neck, so that maybe his head is a little bit higher up for a little while on pillows before he falls asleep. Never suggest someone spends all night in an awkward position. They might wake up really sore in the morning, have positional torticollis, which you'll learn about later, which is a really painful crick in the neck from laying in a strange position at night. Welcome to your 40s. You know, these are things that you can suggest to your client to potentially do for a self-care plan. Okay. Perhaps ice packs for his, you know, for his low left back. I would suggest an ice pack for the low left back. Absolutely. All right. This is our last section here. I don't even know what's happening with my slide. Final things about this note. Oh, here we go. It's just gone wild. Okay. SOAP notes. Final marks on the note. I have some things circled here that are pretty common. All right, so pain, well, you could put a P with a circle around it, right, left, bilateral. All right. I usually put B with a little I, then the big L. Some people put BL for bilateral. So that means both sides. All right. IF or INF a lot of times is used for inflammation. That just depends on what you want to do. So what are we marking down here? Okay, he's complaining of a sore lower back, mostly on his left side, cannot lift his leg very high. All right, we know it's on the left side now. You see that he leans to the left when standing, his left foot is turned inwards, his neck is craned to the right. Okay, you feel heat and tension in the lower left quadrant of his back, lateral to the spine, inferior to the ribs, and superior to the hip. Okay, and he reports it's extremely tender to the touch. All right, so why don't we do a circle for a tender point? All right, we're looking at his back. It's on the lower left quadrant. So if we divided the back into 4 pieces, it would be here. It is lateral to the spine, so it's going to be between the spine and the outside of his body. And it's inferior, so it is below his ribs. So we're going to put a circle right here in that lower left quadrant because it's tender for him. And we also know that it's an area. Okay. We also can put a little IF or something and then, you know, notate it like also right there if you want to do that. You can notate that his left leg, his toes are rotated. We do this little half semicircle there with the arrow. You see it right here for rotation. And then I put another arrow coming in medial so that we know that this foot is rotated in medially. It is not rotated outwards, just in case my semicircle wasn't obvious which way that it was going. Okay. We also know that his neck is craned to the right. So we're going to put this curve for his spine. His neck is going to the right. I'll put an arrow there. And then I will put his body is leaning to the left over here. Okay, so this won't make a lot of sense looking at it unless you're used to writing these type of arrows until you look at the other information that you had written down in your objective, in your visual objective right up here, because that's where you would be putting, hey, his neck is going this way with his head because he's trying to keep his head level over his spine that's way over here, because he's leaning left and also his leg is rotated. We have no idea what's going on with John. All right. Is there anything else that we could potentially put on here? All right. We've already notated the inflammation. We've notated the tender point that he has. We haven't talked about finding any trigger points, so we're not going to do that. We're not going to have any notes about elevation. What we could do is put the arrow for decreased and put ROM. So decreased range of motion. And I could mark it here and mark it on the knee. Circle the areas, the joints that are affected with decreased range of motion. So this is what your notes could look like. You could also, you know, continue over here that is rotated over there. There's not a whole lot that you can do on the lateral side, although sometimes I like to do these little arrows that I point them inwards like this. Okay. If a body part is shortened. Okay. So this body part is shortened over here because he's constantly leaning towards the left. All right. And this is his right. So this side is overstretched. So I could put these where the body part is stretching up and down. It's stretching away from itself on the right, on the lateral side. And because he's leaning in towards the left over here, you can put like a little symbol like this if you want. These are yours to make up as you want to do. So this is just an introduction for you. I know some of you may not be entirely thrilled with your grade, but I wanted you to really think about this and to pay attention to the information, not only in your book, but in the video, to try to have some fun with this for your first try. Some of you did a very excellent job at a first beginning. I know it's a little bit confusing your first time. We can absolutely do another one of these exercises if you like, but I promise you, you will be continuing to do them as you move forward in your classwork. Definitely for pathology and advanced anatomy, you will see another one of these SOAP notes to do again. So I hope this was helpful. If you have any additional questions or if you want any clarification, please absolutely reach out to me on Canvas and I will help you with your SOAP notes. Have an excellent week.